Good morning, I'm George Latimer, Westchester County Executive. Welcome to Facebook Live. This week we're going to be discussing a topic that is an extremely important one to all of us in Westchester County and by extension across the state and the nation. We have gone through the COVID-19 outbreak now for what amounts to 5 months, and we've dealt with the reopening as the numbers have come down of a host of different areas in our society, opening up retail shops, opening up restaurants, first outdoors and then indoors, offices and some businesses and industries that have not yet been reopened. But we're now facing, as we sit here late in the month of July, halfway through the summer, with one of the most important decisions to be made, which is whether or not we're going to be reopening our public schools, K-12 education. That decision in New York State will be made by Governor Andrew Cuomo, who through executive authority will determine whether or not the schools will open and under what kind of circumstances. But the decision to open schools is only the beginning of the process. The real challenge comes in the management of how a school year will work. And as I think we all understand, whether we've gone to restaurants or retail establishments or in our own workstations, just how different life is now in the day of COVID and what steps we have to take. So how much more so will those changes represent in our schools? With that, we have three folks who are with us here today who are very much at ground zero in terms of this situation. We're joined by Ray Sanchez, who is the superintendent of the Ossining Union Free School District in Ossining, 5,000 plus students. We have with us Joe Ricca, who's the superintendent of the White Plains City School District, 8,000 plus students, 7,000 plus students in Westchester County, and Joe Glazer, who is our deputy commissioner of the Department of Community Mental Health, but who has also headed up a work group as appointed by Joan McDonald in the issue of school reopening. And Joe has other members of the county administration and some of the other departments, Department of Health, Department of Public Works, and so forth, to work with him on this task. The county role in working with these gentlemen is not to deal with issues of curriculum or to deal with exactly how the educational process is going to function, but on the mechanical logistics of what it's going to take to open the schools. So I'll start with Joe Ricca. What are some of the concerns, Joe, that you know you have to address in order to open schools if the governor does make the decision next week to say, yes, schools will open in September?
Well, good morning, George. It's great to be here with you, and thank you for having the opportunity, and certainly thank you to the county for the partnership that we've had. It's been tremendous working together. There are so many concerns, but really if I had to crystallize what we're thinking about right now, it's health and safety. How do we move children and adults back into facilities, keep density low, and keep the transmission of COVID-19 and really any communicable illness down? What are the steps that we can put in place and what are the safeguards that we can follow? And that's got to be at the forefront. And I know colleagues all throughout the region, that's what we're talking about. How do we bring our children back into our facilities safely?
And Ray, in every school district, yours as well as the rest, when we talk about opening public schools, K-12, we're dealing really with young people in various different stages of their life and in a time of their life when a couple of years of maturity and growth represent totally different realities. The K-5 reality, the middle school reality, and of course what you get in senior high school. How do you process the different types of challenges between those different constituencies that you have in your school district?
Yeah, thanks, George. And I think I want to start by echoing what my colleague Joe Ricca said in terms of our real focus on health and safety for all our students. But yet we know that in developing an educational program and the manner in which we do that too from a health and safety perspective is going to need to be developmentally appropriate. So we're working really closely with our building administrators, gathering feedback from our families, gathering feedback from our staff, to see how that is done within the context of our schools. What does it look like for our pre-K and these youngest students that potentially is their first experience within the pre-K through 12 system versus the experience of our high school students who are a little more independent, yet at the same time need their guidance in the manner in which we set up, because we have transitions that take place at a high school versus maybe in an elementary school where kids are isolated basically to a set classroom. So it's ongoing conversations with our stakeholders to really think through, and then rolling out some ideas and continuing to gather feedback from the stakeholders to see how we can refine and tweak to make sure we have the right plan for everyone involved.
Joe Glazer, you and I have worked together in state government, legislative capacity. Here we are in county government in a completely different kind of capacity. and there's some very specific hard logistics for which the county government and the school districts overlap, even though we don't have the direct policy involvement that the state does in state education. What are some of the areas that the working group that you're chairing has to look at and to try to be helpful with in order to assist these schools in being able to open?
Well, George, thank you. And I want to start off also by thanking Joe Ricca, who has been a tremendous partner for us as we've moved forward, working with the superintendents across the county and providing us some input and some direction. And part of what we learned from that direction is where we really need to be able to connect with them is testing, contact tracing for COVID-19, what to do for isolation, what to do with quarantine, what to do with their facilities to make sure they're clean and that they are usable and ready to go every time anyone who's part of the school community steps into the building. And that's the piece that we're focused on. You know, we're not in a decision-making role at the county level and working with the school districts other than to tell them these are the people who, based on the testing, have to be isolated, have to be quarantined, what you can do to help protect the folks that you have in your school building to make sure that even if there's an outbreak that you contain it and it doesn't spread throughout the rest of the school or even throughout the rest of the classroom if we can contain it that well.
Now, the last couple of days, the county has been involved with a couple of workshops, remote workshops, to try to cover some of these, these issues about health and facility issues. Tell us a little bit about what we try to accomplish in those sets of information.
The piece of paper I have in front of me is the notes because I don't want to leave anybody out, but this is the synopsis of the 4 workshops that we did. We put them together and we identified and invited all of the appropriate staff for each of the workshops, the superintendents, plus those that were performing in those functions. So the first one we did was on COVID-19 reporting and contact tracing, and we had Renee Recchia and Dr. Hewlett from DOH kind of walk through how the contact tracing aspect works and all of the quarantine and isolation issues. Then we did PPE needs and procurement, and PPE is an important piece because if you look at the state guidelines, different job duties with different contact roles are required to have different forms of PPE. So we literally walked folks through not just the aspect of what PPE you're going to need, but we had Assistant Commissioner from the Department of Health, Pete DeLucia, explain that not all PPE fits everybody, so you even have a fitting process that you have to do, N95 masks, all of those things, emphasizing the fact that we need to do this really quickly because to gather all this PPE up before school starts, we're going to be competing with thousands of school districts across the nation to get the supplies that we need. So we're really pushing them to get this together as quickly as possible. We did a workshop on school facilities, basically how to clean the schools, how to deal with HVAC issues, all of those things. And then the last one we did yesterday was cafeteria and kitchen guidance, just to make the point that COVID is not a foodborne illness, but if you have it on your hand and you touch a piece of food and then give it to a student, now you could be transmitting COVID. So we talked about all of the ways that you can safely put together and distribute and disseminate food in the school districts. We did 2 on Tuesday, 2 on Wednesday, and I think we had nearly 400 participants join the workshops.
That's a very good sign. Joe, as a school superintendent, you sit on top of a very large structure of people, and there are different constituency groups within that. You obviously have a variety of administrators. Some are central administrators, work directly with you in the management of the district. Some of them are building administrators, principals and so forth, building by building, and high school and middle schools and so forth. And then, of course, there's the teacher staff, unionized teacher staff, and you have parents. You have elected school board members who represent the community and are the people that you report to. What is the dialogue that you've had with those different constituency groups? How do they look at the opening process? What are some of the concerns that each of those have raised that begin to inform the way you approach this? And Ray, I'm going to ask you to comment on this as well.
It's a great question, and I think where you have to be and how you have to approach this type of a situation is, first of all, being humble and recognizing that everybody is going to have a different approach and what they think is going to be the best way to re-enter school facilities or to deliver instruction in a remote setting. And every one of those ideas is a good idea because it's what works for that individual. So the challenge for us is looking at re-entering school facilities safely and establishing a remote learning or a blended learning process that is going to be the best for as many children as we possibly can. And we know that that's it's a heavy lift. But having all of those voices, having everybody part of the conversation in terms of planning and taking in all of that information is critical. And we've been really proud to be able to do that. Here's what we also know. Regardless of the plan that goes up tomorrow, we're calling that an interim plan. We're calling it a draft plan because we have to be able to change, George. We have to be able to change based on what we're seeing in the landscape or based on what we're seeing in the region. And we also know that as we move through the academic year, we're going to learn how to do things better. We're going to learn what works. We're going to learn what doesn't work. And so we have to continue to be nimble. But it is important for us as superintendents to be connected to all of those different constituents, to be connected to all of those different stakeholders and the kids, and make sure that we're hearing from our children on the best way to meet their needs during what really truly is an unprecedented time.
And Ray, I have to assume that, as with any group of people, that you talk with teachers, and you have some that are looking forward to coming back and some that have some concerns about coming back. I'm sure there are parents who want their children to come back into the system, and some that, more concerned might withhold them. And so that kind of dichotomy must exist with every one of these constituent groups. And again, then it's also complicated by the relative age of the kids, how you feel about a 10th grader going back to school versus a 2nd grader and so forth. How has the dialogue in this off season been occurring between you and the parents and the teachers and the other administrators to try to get people, as many of them possible, to the same platform?
Yeah, that's a great question, and I think, I'm going to echo what Joe said. I think we all need to go in with the mindset that we don't have all the answers. But that's why it's really, really important for all of us to get different perspectives, is because it's through there that we're going to continue to refine and make our plans even stronger and better. We all center on one thing. There's a couple things that we have in common. Number one, we want what's best for our children and educate them the best we can. The other aspect that we have in common is making sure that everyone involved, our parents that are supporting our children, our staff, and our children are healthy, and that we take care of them throughout. And so with that, we've continued to just be open and transparent about where we stand, whether that's through open dialogue through Facebook and using social media. All of those have been, within those settings, we've gotten feedback. We've had open forums like our board meetings where we've gotten feedback from our families. We're trying to get, I think Joe's point about students is really, really critical, and that's a step we know we need to take even further to see what they're thinking and how whatever our plans are, make sure that they meet the needs of them educationally, but also that they too feel safe. And within that, I think all of us are really focusing on the facts and the science behind it. We're not trying to assume anything else other than the facts and what we know about COVID, and trying to create plans that, again, balance the health and safety being our primary focus. They're also ensuring that we can provide the best educational program, whether it's virtual, hybrid, or if we're able to bring large sets of students in, obviously social distancing within our school setting. It's all focused on making sure that, again, education and the health and safety through different voices and perspectives from our community stakeholders.
And Ray, Joe, do you both presume that you will have a hybrid system of education? Will there be some classroom and some remote as part of whatever happens in this school year? Is that understood to be likely, or is that yet
I would say
debatable?
At this point in time, and obviously, as you mentioned before, the governor still has to make his decision. He'll notify us next week. That right now where we stand, it's likely that it would be a hybrid setting. However, we recognize a number of our families are very, very concerned about sending their child back to school either way. And so we're really trying to balance to see if, in fact, we can do something to help support them at home as well. And that varies around the region and across the state as to how we can provide maybe a virtual setting fully, as well as a hybrid setting for others.
Joe?
I think the coronavirus, COVID-19 pandemic of 2020 has really been a disruptive force in the public education and profession. And what we're seeing now is how public educators, and I really have to tell you, teachers and administrators, these folks have done amazing things and are redefining the way in which we deliver education and support to children and families. Right now, with the guidelines that we're facing and in our efforts to continue to keep the curve, the so-called curve, flat in our region, in our state. It seems unlikely we would be able to achieve density in a full come back to school manner. But I will tell you that in our hybrid approach, thinking about being able to provide that instructional connection to our children, that's going to be really individualized in the sense that our teachers are going to know what's happening with our kids. And if we are able to come back and that more students in classrooms, that's going to be outstanding. If we do have to go in a fully remote environment because we're experiencing an eruption of COVID-19, we need to be prepared to do that too. And at the same time, support that social emotional need at home and work with those parents and guardians who are concerned about sending their children back into facilities. There are a lot of folks in our communities, all throughout our county and all throughout our state, who haven't really left their house in 4 months.
Right, that's true.
And you know, as educators and also as parents of school-age children ourselves, Ray and I talk about this all the time on the weekend about our own kids. You know, we have to be very sensitive to the social emotional needs of folks as well as the academic needs. And it's a big lift, but I will tell you, our teachers, particularly our teachers in Westchester County, are coming through and they are doing what it takes to make sure that we're supporting our children.
Joe, in your responsibilities, normally you're dealing with community mental health, and along with Commissioner Michael Lorth, you've really shown a great insight into the different constituent elements that have to address in that area of public policy. So we have schools that are established outside of the geographic school districts that treat children with special or work with children with special needs. How do you see that issue from the policy side affecting the logistics side of how education gets delivered? Because obviously these are kids whose learning capacity is structured very differently, you know, than those who are going to the normal public school districts.
You know, George, you make a really good point, because from a county government perspective, so much of what the schools do connect to what county government does. We have schools, for example, as you're talking about, children with special needs. Many of them are either licensed or operated by the state's Office for People with Developmental Disabilities. Mm-hmm. Some of them are residential, you know, where the kids live there and either go to school there or may live in one location and go to school in a different location. You know, so that touches on the piece that we do, having to do with dealing with congregate housing, residential living, those kind of things. School districts also are responsible for teaching the children of families that have no shelter, homeless families. You know, so as we're going into this equation going forward, we know, as we have been doing since March when all of this started, that we're going to need to help folks who are COVID positive. We're going to need them to help them isolate. We're going to need to be able to put them in a safe place where they have access to the services and the kind of oversight they need. You know, so we worked, and as you know, we worked very hard with the Department of Social Services to come up with what has become an extremely effective plan for that. Mm-hmm. But as we do that, we also know that we're doing that to assist the school districts in meeting their needs as well. So although we talk about this from a health perspective, there are so many places where we are intersecting. We've had a lot of conversations. The largest number of individuals under the mental hygiene law who are living in congregate housing in this county are in OPWDD licensed or operated housing, and we've been working with the state, the Hudson River Field Office, day in and day out, as we go in and we test residents, we test staff. And what contact tracing has done is it's led us even more to specific cases in these communities, meaning that contact tracing will show someone who is a contact of someone in one of those housing or residential facilities, and we go in and we work with them, because the purpose of contact tracing is to quarantine people before they expose others. Right. So you may see the numbers go up a little bit through contact tracing, but the goal really is to identify the folks and get them out of circulation, essentially, so that they can't transmit COVID to others.
To the extent that we have dealt with the degree of infection since we put a contact tracing system in place, how has it worked? I mean, we understand that it is sort of the detective work of talking to an individual who, for the sake of the discussion, is tested positive, and in theory they identify the people they might have had been in touch with over the course of the 2 weeks. How's it worked in practice as you've observed it so far?
It's interesting, because I think it's a very effective model, but it relies very heavily on people willing to self-disclose and to give certain personal information, like who were you with yesterday, what did you do, where were you, all of those kind of things, and that's somewhat personal. But I also think, and Renee Recchia pointed this out during the workshop earlier in the week, that because Westchester was hit so hard, so early, we're generally amazed at how forthcoming people in this county are as far as revealing information to the contact tracers so they can do their job. I mean, as you remember in that second week of March when I was asked to go over to DOH, we all felt like we were building the plane while we were flying it.
Right.
Since then, we've really been able to bring all of these things together under the rubric of the schools and the county and DSS and the local municipalities, and everybody has worked together. And I'm not going to say it was seamless and it's not flawless, but it has given us a great opportunity to connect, and the numbers themselves speak volumes of how well we have done in getting ahead of this pandemic.
Just from my own perspective, as I hear each of you, talk about the different challenges before you, I go back to what you said, and I think it's been intrinsic all the way through this process, that so much of this comes down to the individual recognizing the moment that we're in and being able to understand that it is a moment of sacrifice for which normal structures aren't going to be the same. And you have to adjust to that. And you adjust to it in one part because we're, mature people that, we can whine a little bit about having to wear a mask on a hot summer's day or, whatever else the other impediments to normal functioning would be. But because what's really essential in all of this is public health protection, that we don't wear masks to make a political statement. We don't do contact tracing because we want to get inside people's lives. We want to try to save lives. And going into a school setting where a third to a quarter of every home within a community has a child inside its public school setting, that becomes arguably the greatest network within a community. I mean, we all have, we're involved in organizations, neighborhood associations, and civic clubs, and our circles, concentric circles in a community. But nothing touches a community more thoroughly than the school district does. And I would even, remember when my daughter, who's now a grown woman with children of her own, when she would come back from elementary school, we knew that she was our little germ collector. She would be, in contact with every other first grader, getting whatever was the disease of the moment and bringing it home, into our house. Now, that's not just a laugh. That's a serious element of all of this. We've just about used up the available time, but I want to give each a chance to sort of summarize some thoughts. We are at a point before we have to actually go forward. We'll work on the assumption the governor will authorize schools to open. If he does not, then we'll have a different way to work. He'll make his decision as he sees fit. But Ray, what do you think the priorities are going to be for you in the month of August in anticipation of the doors opening in September if we get a green light signal to open in the next few days?
Well, I think for me, it's continuing to refine our plan. Once we know and we understand, we're going to continue to work together to make sure we can do this. And that, the other part of it too is making sure that we continue to aggressively communicate with our families and with our communities as to the status of our plans, and to continue to get feedback and start setting this up to become more of a reality and what our schools will look like. It's taking from the paper and pencil now to really actually starting to look at it from an operational perspective. Not that we haven't, but now it's becoming more of a reality as September looms. Continue to work with you and the county executive, or with yourself as the county executive and your team, and our continue to work regionally with our superintendents to see how, to the extent that we can work regionally and align ourselves and continue to support each other during this process. I'd be remiss before we close is to, and I think I know Joe mentioned it, is the gratitude to our staff, our teaching staff. They turned on a dime and started to really kind of shift the manner in which they were providing instruction while still dealing with their own children at home. Gratitude to to yourself and your team, but also to our parents. They have really, in many cases, they became the primary teacher. While they were providing instruction virtually, they were there with their child at home while still managing their work. So just a sincere gratitude to everyone that put public health first, but yet made their own personal sacrifices to make sure that we were there for our children during that, very difficult time. And I'll continue to thank them as we move forward.
It's a wonderful attitude of gratitude. Joe, the month between 30-some odd days between here and there?
Well, I think the understanding for this work group is that it was really created for two purposes. One was to very quickly assist and provide whatever was needed to help create the plans. From this period of time going forward, and I can't tell you when it's going to be done, Our goal and our role at the county is to help effectuate these plans, and that's really what we're looking to do. Help the school districts meet their needs, solve their problems, do what we can so that they can be successful in what they're trying to do. Like Ray, I really appreciate the work group that Joan has put together. She's given us a great group to work with. There are two people on your staff who have basically been my right and left hand, and I'm going to give them a shout out, and that would be Aviva Meyer and Susan Spear, who have been instrumental in helping us accomplish what we've done so far and are continuing to work right now on putting together the documents we will use going forward to make sure our lines of communication and what we need to do to work with the school districts are the best they can be.
Joe Ricca, White Plains?
Well, much the same as Ray mentioned. We're going to continue to refine our plans. But yesterday we surpassed 150,000 Americans who lost their lives across the country. This is still very much an issue. None of us believes that not having our children in our classrooms with our teachers is ideal. But in order to get there, we need to do exactly what you were talking about. That individualized responsibility for each other and ourselves. So, years ago we would power through a cold. We weren't feeling well, we would still go to school. We would go to work. Can't do that as we enter the fall. If we want to be back in our buildings, if we want to be back in our classrooms, and we want to stay there, we need to make sure that parents and guardians and caregivers and employees and everybody involved in the schooling process is monitoring themselves, taking care of themselves, and making sure that if they're not feeling well, they're staying home. That's going to be a critical component for all of us moving forward. So the plans and the services and everything else, we're going to continue working on that. But if we keep top of mind right now that taking care and looking after ourselves and our own wellness will keep us moving forward, I think that's what's going to make the difference in our region and in our state. We are a state that is stable right now, surrounded by, unfortunately, chaos in terms of the spread of the illness. We want to stay where we are, and we want to keep those numbers going down. And if we keep doing these things, and if we keep working hard to make sure that we're containing, I think we'll keep moving in a positive direction. And certainly we want to welcome our children back in the fall.
And we want to thank you, Joe Ricca, Superintendent of the White Plains School District, Ray Sanchez, Superintendent of the Ossining Union Free School District, for being with us today and being partners with us throughout this process. Every Monday morning call, we look forward to at 8:30, our conference calls. And Joe Glazer, Deputy Commissioner of the Department of Community Mental Health, who has stepped into the breach not once but more than once in this particular pandemic and this situation. I think just, for my purposes, to summarize the conversation, we will continue our, I think they're weekly now, Facebook Live conversations. We at various times had them more frequently. We'll continue the updates on Mondays at 2 o'clock to try to give you an idea of the spread of the contagion. But I think something that I think struck us all right in the very beginning of this in March is really a test for each of us. Right now we've talked about what is the test that faces school districts, and there's 44 of them in Westchester, some overlap into Putnam. How do you provide that educational service given the fact that we're in the middle of a pandemic that is highly contagious and fatal? We've lost 1,430 some odd Westchester residents since the 1st of March, people that we know, people that we love, people that are important to us. We have the Ribbons of Remembrance program down at Lenoir Preserve at Yonkers, so we don't forget the human element of this. This is not just a political issue. This is not just the debate that we have while we're sitting with masks, having a cup of coffee, and we like this, we don't like this. But as I think we all have come to understand, to open a pool and a beach, to open a certain recreational facility, to open a restaurant, to open a business, an office or a retail business, every one of these things, we have to go through the same professional analysis that these men are going through right now. How do we do this safely? Because we're facing a pandemic that has taken human lives. And we have to be serious about that. We're in a political world, those of us in public office. There's a yin and yang to politics. I've long since understood that and accepted that in my public career. But at some point in time, we have to rise above that. We have to rise above the disagreements that are natural in a democracy. And we have to understand that our destiny isn't me doing my thing in my own way and you doing your thing in your own way. But that if we're going to survive, there's going to be a common destiny. And that common destiny requires us to make sacrifices for each other's benefit. It is not merely me doing whatever I want the way I want to do it. You might not agree with that. You might not like that. But that is reality. We're not going to open our schools. We're not going to be able to maintain what might be a second wave that might yet come that we don't know until we see the vaccine, until we see the antiviral, until it's universally available, and until public science tells us it's universally effective. And we're not chasing after every Facebook post that gives us hope that something is here, whether if it isn't truly here. And this is the long haul. This is the beginning of month 6, and it could be the beginning of month 16. We don't know. But whatever it is, we're going to have to reach deep down inside. We're going to have to use the best abilities that we have, train professional educators in their field of endeavor, those in the mental health field, those in every other field of endeavor, and those of us who have general authority and responsibility to make sure that we see every day the sacrifices that we have to make. And what's the alternative? I'm George Latimer, County Executive. Thank you for watching. We'll be back next week with another Facebook Live, and we'll see you Monday at 2 o'clock for an update of where we stand with the coronavirus outbreak. In the meantime, take care and stay safe.